June 17th, and let's dive in with today's COVID-19 briefing. And we'll go first. We're fortunate to be joined for the first time in a while, Dr. Leffler, the president and COO of UVM Medical Center. And it's become a tradition of sorts over the last 3 months now that we chat with Dr. Leffler on Wednesdays and talk about the status of the virus here in Chittenden County and how the hospital, the front line of this fight in many ways, how the hospital's doing and what we're seeing up there. And I think it may be 2 weeks, Dr. Leffler, since we talked, and in those 2 weeks we've had our first real challenge, I would say, to Chittenden County in the area since the reopening began in the end of May, early June. And you can see, this graph is the one we've been tracking all along that shows the number of hospitalizations at UVM Medical Center. The next graph that Olivia is going to bring up here, if you could jump to that. This is from our dashboard, and I do encourage, I go to the dashboard pretty much every day. It's a really good way to monitor what's going on with the virus right now. And this tells, I think, an interesting story. To me, it tells a hopeful story, and I'm interested in your reflections on it, Dr. Leffler. I mean, what you can see there on the left side of the graph is the start of this pandemic, the March and April, the number of cases in the area going up, there's some real peak there. We also know about that era is we were doing a lot less testing than we're doing now. So the actual number of infections, I got to believe, during that period was much higher than that, but these are the ones that we knew about. And then it kind of drops precipitously the last half of April. There's very few new infections throughout pretty much all of May and the last half of April. And then we know a couple weeks ago, this outbreak began in Winooski and spread to the Old North End in Burlington. And that I see as the first real test since reopening. Do these new systems that we have of testing, isolation, tracing, and quarantine, can we actually box in this virus like we've talked about so much? And when I look at this graph and I look at the reports I've gotten from the state epi team the last couple of days, where we haven't had new infections related to this outbreak in the last couple of days, this suggests to me maybe we can do this, Dr. Leffler. What do you think when you look at this graph? Maybe we actually can box it in, is what I'm thinking.
So I actually think you did a good job of summarizing the current situation. As we've been saying, both on this Wednesday meeting and for months, is that we expect to see some spikes and surges going forward. We know COVID-19 is going to be with us for quite some time, so it wasn't surprising to see our first test of the system with the Winooski outbreak. And to your point, and I think it's a good one, it is trending back down. So I think we can be cautiously optimistic, but I want to stress cautiously. We won't really know if we've really managed it perfectly for another 2 or 3 weeks. But the data shows that the number of new positives is not growing. In fact, it's trending back down towards our May rate, which means that we probably have done a good job of quarantining these people, tracing their contacts, making sure they quarantine and get it back under control. And I completely agree with you that should lead us to be somewhat optimistic that in Vermont, we can do a good job of testing enough people, catching surges quickly, and getting those people quarantined, and then carefully tracing all their contacts to contain the virus. So I agree with you. I think this is a graph that should make us be cautiously optimistic. We knew this was coming. We knew we were going to have one of these, and it could have been the opposite. We could have seen it keep growing and growing. But at least for this Winooski outbreak, we got a good handle on it quickly. And we still remain in very good shape in the hospital. We have 1 positive today, and I think we have 4 PUIs today. So hospital capacity in the state is excellent. I think we have the only patient in the state right now that's in the hospital. And overall, we're doing a lot more testing. So I agree with you. I think it's reason to be cautiously optimistic about how we did.
Excellent. Good. I feel more confident in it coming out of your mouth than out of my head here. So I'm glad that's where you're seeing it too. I would just add to this, we're on June 17th now. We had all this focus on June 1 as a date that we knew hundreds of students and others were returning to Vermont from out of state. If they were bringing the virus with them and infecting others, I think we'd be seeing that now in these numbers. I feel maybe I'm with you. I'm on the cautious optimism part there too. It could be too. Maybe we're just a little early in knowing with confidence that what's happened with that population. But I would think by June 17th, if there was a big new infusion from those people coming back, we'd be starting to see it. And it doesn't look in the numbers like that's happening.
In general, I agree with that. You got to be a little tricky with that because, first off, I think it's almost without question that some virus came into Vermont
Sure.
in early June because we had people coming here. And so I'm sure there were asymptomatic people that came. But and I've been looking at this a lot, if you compare Vermont right now to a lot of other states that are having very significant upticks in coronavirus, upticks in hospitalizations, upticks in the rate of positivity on a daily basis, Vermont's really still doing it, I think, right. I think Vermont at this point, people are in general all masking wherever they go. We are really socially distancing well. We're being very smart about how we reopen up our businesses, how we get people back out. And so that also makes me, number one, proud to be Vermonter, proud to see how we're doing it different than other states, which have really just basically said, go back to normal. And every night on the news, you'll see people that are not masking and stuff. So what I would take from the June reopening of Vermont and the steps that the governor's been taking is that the things that we put into place around that, masking, socially distancing, keeping people somewhat separated when they're in public places or going into our businesses, is keeping the rate down. And I really see that as our path. We have to be able to manage coronavirus being here for a couple of years, I really think. And I see the things that we're doing for Vermont as a way to do that. I mean, let's be honest, people are going to be coming into Vermont over the next couple of years. People are going to be leaving Vermont.
You need that.
Right, we need that, and we want that. And so can we do that safely? And just like the Winooski issue, since people started coming back more in June, we've been able to manage that. And so I think we should also be cautiously optimistic that what the places that we have in place are keeping us safe and not overwhelming our hospitals. So I think it's a good news story.
Good. And we'll have more to say on the kind of the June 1 plan and the quarantine efforts. That's why Zach, who at the beginning of the call, we'll go to him in just a couple minutes to talk about the supportive quarantine effort, which I'm hopeful has had a role here in making sure that people come in did not spike new outbreaks of infection. But before that, we had another slide I think we wanted to go to, and it's sort of on the related to what you were just saying there, Dr. Leffler, that we're doing a lot of things right. I do sense that the businesses and organizations that I work with and have firsthand knowledge of are, really looking carefully at the governor's guidance and working hard to make sure that all the systems are in place, the daily screening, the temperature checks, the face masks in the settings that's important, the hygiene, and layering all those elements on top of each other. So that's one way to think of it. And I think that's part of the story, that there's been such high level of commitment to that's how we're able to be opening now for really a month. We've been moving into the opening incrementally, and things seem to knock on wood be looking pretty good right now. Here's a new way we have started talking about this. And I love your thoughts on this slide, Dr. Leffler. This is a little bit different messaging than, I think this is new messaging, updated messaging that is reflective of the updated science and understanding that we have of this virus. This graphic actually comes, I believe, from Japan. And they're a few weeks ahead of us in this. They've been, and I believe this may be the way Germany is talking about it as well. I could be wrong about that. They are talking now avoiding the 3 C's: closed spaces with poor ventilation, crowded places with many people nearby, and close contact settings such as close range conversations. I mean, that turns out to be one of the more dangerous things with this virus is being in a room with someone else that doesn't have great ventilation and talking loudly. And then that on the right part of this graphic is showing that when you got all three of those things, crowds, indoors with bad ventilation, and close contact settings, that's when you really got to watch out. That's when you have the real possibility of a super spreader event. We saw a little bit of that. It turns out we know now at the UVM basketball game right in the early part of March. So here, I found this helpful when I saw it. Curious your reflections on this, Dr. Leffler.
I think this makes a lot of sense. I wish the picture had people wearing masks. I mean, there's pretty good evidence now, and it's funny, early on we were saying we didn't think masks were that helpful, but there's pretty good evidence now that really shows that each of us wearing a mask helps us prevent spread to someone else. And so I really see wearing a mask as a way that we can help get things back to normal. It's a relatively small sacrifice that each of us make that we can keep transmission down. And so I think these 3 C's are really important. And I think that they make sense. But once again, as we're getting closer back to normal, we probably will be going occasionally into closed spaces without great ventilation. We can do some things about avoiding crowded places with a lot of people. But wearing a mask is one extra level of insurance that if you happen to carry the virus early before you're sick, you're not giving it to someone else in those places, or you're less likely to, I should say. It's not 100% protection. I do agree with this. I think it's good advice, and I think it makes sense. And I think it's one more thing we can do to keep the transmission rate down in Vermont.
Well, we're gonna do our own Burlington version of the messaging here. We're one of the great services the RRC has done since the beginning of this is push out information and create graphics that make sense for the Burlington setting. And so I think, we'll make sure the X's are bigger, because I think they're saying don't do these activities without a mask. I agree. I'm really thankful the analytics team for the city understood early, well before the CDC and others were kind of all in on masks. We were here in Burlington. It's a point of pride when I see people around the city wearing the more than 22,000 masks that the city fabricated in the early weeks of this pandemic. There are still some available. People can go to the website, city's website, if you need a mask. It's kind of amazing that something so simple as kind of a well-constructed face covering can have such a profound impact on this terrible epidemic. So, Dr. Leffler, anything else you'd like to share before we say goodbye for a week or so?
No, once again, I think good news, and I think people are doing the right stuff. And as we cautiously get things closer back to normal, it's good to see that all the safety things that we're doing are so far paying off. So I think people should be encouraged that Vermont has continued to do quite well. And that's good news. Thank you.
Great. Well, thanks for joining us. We'll see you again soon. Look forward to talking to you offline as well and keeping our various efforts going. Thanks for your service. It's good to know that things are under control up there in the hospital. We'll talk to you again soon.
All right. We'll see you soon.
Olivia, let's keep going. So I did want to, add to the conversation further a couple points regarding the major conversation, the reckoning we're having about racial justice as a country, racial equity here in Burlington, and specifically how this budget that we have a responsibility as a city government to pass, adopt the new budget by the end of the year. On July 1, the new big budget year begins, and the charter requires us to have a budget in place before that date, or really, so we've got a big job given what a challenging budget year this is, with maybe 15% of our revenues just disappearing, and with in the 3 weeks and a couple of days now since the murder of George Floyd, a focused conversation about transforming policing. And I did just want to clarify one element of the budget that I submitted Monday, and just make sure that it is clear how we are laying it out here. There is in this budget an immediate commitment of $300,000 that will it really basically flows from the cuts that we made in the police department budget. It immediately is going to be available for this, what we're calling this Racial Equity and Police Transformation Fund. That is that as the budget was submitted on Monday is what is immediately available. And what I said at the time, and I want to clarify here, is I have a high degree of confidence that the budget overall is conservative enough that very quickly there will be a waterfall of events that basically, as we get into the budget year, and maybe we can even do it before we have to start the budget year, but that the additional funds that will become available that will expand that up to the $1 million was the way I submitted it on Monday. I just want to make sure that point was clear, that there it is, I think, a high likelihood that is going to be available. And that's good, because I think we have a number of ideas that we want to act on quickly. I've committed in response to the many people we've heard from in recent weeks that making the point, which is, one we agree with and think there's an opportunity now to make good on, of having mental health professionals respond to some of the calls and some of the actions that it falls to police officers to do now. And so there's some immediate efforts there that we've committed to come back by July 15th with an update on, and hopefully be able to move quickly on that front. But I do want to also be clear that that is by no means everything that we hope to achieve out of this Fund for Racial Equity and Police Transformation. We know we also intend to fund a new racial equity position out of this fund. I've proposed, and it's now in the hands of my colleagues on the council to see whether they agree with this, but I see great value in having some kind of analytical report that involves further discussion with all involved stakeholders as quickly as possible upon the completion of this budget, to come to a new consensus about what we want our police to do and not to do. I think it's going to be very difficult to reach that new consensus in less than 2 weeks before the budget needs to be approved. I think we can get there quickly, however, and with that new consensus, make change together. And that's what my hope is happens as well with that proposed study and process, and more. And that's why it's important, I think, that this be a $1 million fund. I think we've all seen the last 3 months what the city can do and how the city can move quickly if it has the resources to respond to a crisis. We have gotten a lot done, like the face masks we were just talking about, as a city in the last just over 3 months, because the council supported the idea of putting $1 million into a fund that we could act quickly with in response to the pandemic. And I think having that kind of rapid action fund is one of the reasons why, it's certainly not the only reason. I want to give great credit to the Department of Health for what they've done. They're on the front lines of tracing and containing the outbreak, but the city's been able to help. The city's been able to move on that front and many others because we've had resources. We have a very similar, I think, situation here with racial justice. There is this moment that we need rapid action, quick investments, immediate progress, and having a significant fund that we don't know exactly today, and we're not going to know in the next 2 weeks exactly how we want to use, but that we can deploy quickly in the months ahead, I think will have value for us there as well. I also want to make it clear that $300 to $1 million fund is not the only city resource that we have made decisions in recent weeks to deploy in service of racial justice and protecting BIPOC communities. We have over $300,000 of just approved small business relief and rental assistance funds that were these are monies that come from an emergency federal allocation of CDBG dollars, community development block grant dollars. And when the council approved that a couple weeks ago, we were clear that all of that spending is going to be done through the lens of our recently released 8-point plan for protecting vulnerable communities and ensuring a just relief and recovery effort. So that doesn't mean that every penny out of this is going to go to a person of color, but what it does mean is that we are going to be looking through the lens of racial justice. We're going to be looking through the lens of knowing that Black Americans are dying at nearly 2.5 times the rate of white Americans in this pandemic, and that we need to take extra actions to protect people of color in this emergency. And we're going to be looking through the lens of making sure these resources are getting to the people who need it most, which is not, is not how these federal programs are necessarily designed. We're going to make sure the way they're implemented here on the local level achieves that. And so that's some additional resources. Further, there's it's a little bit more of a forward-looking conversation, but in the near future, over the next 12 months, we will have about $1 million more in federal funds coming into the community that we have not made any commitments to with. This is our community development block grant dollars and our home funds, and a lot of these are targeted towards housing programs. And I am very interested in a conversation with the leaders of the Racial Justice Alliance and really everyone who wants to engage in the process going forward about, in a way that we really never quite have before, ensuring that that same lens of racial justice is applied to how we spend this $1 million of federal funding a year going forward. We know that much damage was created by federal action and federal funding in the past. There was explicit racism until our recent history in how federal housing rules worked and other programs. Let's see what we can do to reverse that with our federal funding. And again, this is another, all three of these programs, which you can see add up to potentially more than $2 million over the next 12 months, are and really the third bullet of federal funds, that will be something that is approved about a year from now, but it is then ongoing from there. This is something that we consistently get. I think there's some real opportunity in looking at all of these funds as we figure out how to make progress in this moment on racial justice. Let's keep going, Olivia. Couple other updates on policing. I did just want to note, I want to thank the Burlington Police Commission for their rapid action in a couple meetings to adopt a new use of force policy last night. This was a step that Chief Murad and I, has been teed up to happen as a result of a community process that lasted from last August until February, and then it slowed down with the pandemic. And then in the wake of the murder of George Floyd, it was clear to me we had to act as quickly as possible. And we this use of force policy is much better than the one it replaces. It meets all of the 8 can't wait provisions that President Obama and others have talked about, and then it's been really on the kind of forefront of thinking about how to reform policing to do something about police brutality. And I just want to be really clear. I know that's not enough. I think there's an important step. I welcome that the Police Commission took this step. But there may well be additional refinements to the use of force policy that the commission and the council might want to pursue with a more deliberative process, and I'm certainly open to that conversation. But beyond that, use of force policy is just one piece of ensuring that the policing that happens here in Burlington, Vermont is the type of policing that we want. And I've been speaking for the last couple of weeks. I shared some additional ideas on Monday about other ways to address that conversation, and I think there's going to be much more of that in the weeks ahead. The other I did want to come. I wanted to say a few more things about school resource officers as well. On Monday, I was laying out my budget, and I was clear that in the budget that I've submitted to the council, there is still funding to continue the school resource officer program, and that is still what's in my budget, and I'm not looking to change that at this point. But I do want to expand on that position in the wake of really two things happening since Monday. One, um, this communication that I received from Superintendent Obang, that was a letter. Um, there's been questions that have been raised about this letter and the integrity of the letter, and that combined with the additional conversations I've had with directly with leaders from the RJA, with individuals who are on my coffee this morning, and what I've heard from the hundreds of people have called in, zoomed in to the public hearings over the last 2 weeks. They have an additional point that rings totally right to me, which is even if that letter had been fully accurate, it's not clear that that position of the administration is based on enough conversation with parents, with students of color in particular, and with activists. And so I think we have an opportunity here before there's some time before school resumes, and we were in the process of updating an MOU between the school district and the city in any case. And I guess what I want to be clear is, in the wake of the last couple of days, I think it's critical that the new superintendent, Tom Flanagan, with the support of his board, lead a process that does engage all those stakeholders, and they review this policy and whether this is the right thing for the school district going forward. And this is we try to be a good partner to the school district, and so if they come out of that review and they still want to go forward with this program, and there's been good process behind it, I am inclined to be supportive of the leadership of the school district, but I think they've got to really do that work before I can feel good about signing an MOU and continuing the practice. So I talked to Tom Flanagan this morning. He's been joining, and I appreciate this. Some of the calls the city leadership team is having, even though, and I'm not sure everyone understands this, like the Burlington School District is a separate legal entity from the city of Burlington. We both have Burlington in our name, but that we really operate independently. We work best when we're working in partnership with each other. He's been joining in his early days these teams, and he sounded comfortable about a process like that. He said it's something that many superintendents around the country are doing. So I'm hopeful that's how we'll get through this, and I'm looking for that to happen before we actually release any of these budgeted funds, if they are approved. So that's my kind of expanded position there. Now I want to talk further about the city's supportive quarantine pilot program. Really, I'd like to stop talking a little bit. Just said a lot. Let Zach Williamson come in here, who's been on point with this effort. He's really been leading this effort, this brand new effort. I don't think the city's ever done anything in the last 100 years. Maybe they did back in 1918, but it's pretty new activity in recent years to have a supportive quarantine pilot. We're more than 2 weeks into it. How is it going, Zach?
Thank you so much, Mayor. Yeah, it's a pretty amazing program, and it's going really well. I'm very happy to say. So you can see the slide up here. Just to get us started, there's a little bit about this program written right there, and I'm going to describe it a little bit more detail. Also, I'll get to this, but that photo is a photo of what's inside our welcome bag. So as part of this program, once you've registered with the program and we verify you're here, You get a welcome bag delivered to your door, and some of the things you can kind of see in there. Actually, that Census 2020 water bottle is left over from UVM. UVM was going to do a big census drive that obviously didn't happen, so they were nice enough to offer some of the items they were going to be passing out. So you get a Census 2020 water bottle and a bag, a reusable bag inside there as well. An amazing thing is with the Fletcher Free Library, you get a library card that's already coded to your identity and your name, and you're already registered. And that is meant to enable you to have some great resources while you are quarantining by yourself, we hope. There are a lot of great online and digital resources from the libraries team. And then we have some amazing branded hand sanitizer with the city branding on there, some reusable face masks, and then that's an info doc that tells you other great online resources, city and otherwise, from the local community of things to do in Burlington. There's usually not photoed, there's also usually some kind of what I call a star item. We've included Miss
I was looking, that's the one I wanted to see in the photo.
I know, we ran out. They all had to go out, and
actually, what I really would like is some samples of the star items.
Okay, we can work on that. But these star items have been a rotating featured item that, you know, we're going to the work of putting these bags together and getting to people's doors. I wanted something more than PPE and literature for you to look at or enjoy. So there's been Miss Weiner's Donuts has been included, a lot of that, and thank you for her support, as well as cookies from Great Harvest have been in there as well. So it's a pretty, you know, that alone is a cool thing, but the fact is that's part of a much bigger program. So as you know, you can go online to the city's website, and anyone returning to Burlington is strongly encouraged to register with the city. It's not any official registration that goes anywhere beyond this program. It's simply your name and some information about what you might need help with, whether that's grocery delivery, whether it's supportive and emotional help, or you know, unemployment assistance, any other questions that you might have. Some people truly don't know what it means to quarantine, what is right to do, what's not right to do. Registering with us allows us to get you in our system and allows us to work with you through this program and really, as it says, support you during this quarantine. That, as I think I mentioned last time, that means that I send you an introductory email that kind of acknowledges whatever you might have registered for. And if you did, say, want grocery delivery service, set you up with a volunteer. It also puts you on a list where someone from the city, we have great people here in the city who are calling everybody or emailing, but we start with a call. That's the ideal situation. Every single day for the duration of your quarantine, ask how you're doing, check in with you, and continue to answer questions that pop up. Maybe you didn't need groceries when you first got there, but you do now. Or maybe you need a fan in your room and you can buy one and pay it with your own money, but any way we could bring it to you. Well, yeah, we can do that actually through an amazing group of volunteers that we have. And then after the first 4 days or so, we do offer another incentive to go the extra distance, and that's a gift card to a local restaurant that delivers. That has been super popular, both with the restaurants and with the people quarantining. It's just a little item to entice you to stick with the program and get it out there all the way to either your test or the 14-day mark. A note about testing: it's a great vehicle for us to talk about testing and where you can go to get tested and how you get tested. We have great stories back from other people who have done this about how the test went. For anyone that's nervous, that, you know, most people say it's not a problem, it's easy to do, and we can tell people how to do that and where to register and share that information. And then they're so happy, you know, they don't have to share this information with, but it's amazing to hear people say, I got a negative, I'm good to go, thank you so much. And so we can hear back from people and really close that case. So speaking of graduates, right now, just in terms of the numbers you see in here, we have 150 plus. We actually have a total of 185 people who have registered with us so far. Of that 185, 76 of those, as of just a little while ago, 76 of those are what we call active. Those are participants that we are in touch with on a daily basis and working with through this quarantine. 92 of those already at this point have graduated from the system. So those are people who registered with us, were active, and kept in touch with us, and we kept in touch with them. And they either went the full 14 days or got a test back negative. And then what's amazing is out of those 185, only 17 are people that registered, and then despite our reaching out, we never were able to connect with them. And that's not a bad rate. That's 91% of people who register actually are in it to win it and do a great job with us through this whole program. So we're really happy about that. As this goes on, we're getting, as it says here, about 10 new registrants every day, give or take. And then, people graduate, who are active. Once they've done their program, they move on to the graduate status, and we keep going from there. Another great, I'll wrap this up soon, but another really great thing about this is whether or not we are getting people to quarantine fully, or whether or not we're reaching every single person who is new to Burlington, the amazing handbill distribution and social media presence that we've had has really gone a long way, just in terms of education. So I myself, when I walk my dog around the neighborhood, I see these, that it says "Back in Vermont?" ? And then tells about this program, and why it's important. And I've seen those handbills taped to people's doors, taped to people's mailboxes. They're all over the Walgreens downtown. It's really amazing. And that's through the work of the city, and both UVM Office of Student and Community Relations did a ton of that work as well. So we can't underestimate just the education aspect of of a program like this. And I think, knowing that this will be with us for a while, it really can pay off in big ways down the road if you need to quarantine again, or just knowing about how to be safe. And a lot of people say, well, how do you know, if someone's active, are they really telling you the truth? Are they really staying in their room? And we don't know, obviously, but we are confident that something is better than nothing. And if they're quarantining 75% of the time, that is way better than not quarantining at all. So through our talks with them, we really do get the sense that they are, for the most part, doing the right thing and making the right choices. And that's what this is all about, for sure. And so, yeah, it's an amazing, the feedback from the people who are doing the program. Most students and other Vermonters who are people who have just recently relocated to Vermont are just astounded at us doing this, us kind of caring that much, us kind of turning this into a community effort where it's in everybody's best interest if everybody does this safely. And so it's a pretty cool initiative to be a part of, that really helps do what we want to do, which is get through this together and with everyone's health. So yeah, and as is noted, the last thing on there, we are doing a survey just to get some real good feedback on this program, what worked, what could we have done differently. And so anyone who graduates from this is doing a simple online survey. And we'll get that information out as soon as I don't know when this program ends, but as soon as we feel like we have a good benchmark to take measure of where we are, we'll do that.
Great report, Zach. I'm really looking forward to that data from the survey. I'm also hoping we're able to cross-reference the people who've been as part of quarantine with the state's testing lists and understand if we have heard some anecdotal indications that at least one or two of the people that have been in our quarantine tested positive. And you got to think there then that the quarantine effort did something to help there being an expansion, a new bloom of positives. And so as far as when this ends, I mean, my perspective on this is, look at the numbers you have up there, that 10 new people are still registering every day. This is likely to be an ongoing service that, if this works, if this is actually doing something to reduce the harm, something to help slow down the spread of the virus in our community in this extended period where we have to be trying to box it in, I'm inclined to keep this going, turn it from a pilot to something that we keep in place until that great day that's hopefully not that far out, when we can all celebrate having gotten a vaccine or treatments that render this deadly virus for a small but significant number of people, that we have treatments that really address that much better. I think we're in for a long fight. I think this quarantine strategy is likely to be a significant one. That's what the experts have been saying to us. This is one of our first real tests in Vermont of the quarantine effort. And so I'm looking forward to having you back soon, Zach, when we have some of that data and can talk about where we go from here. But in the meantime, what does someone do if they want to sign up?
You can go to it's real easy. It's on the website, just burlington.gov/quarantine, and you get right to a really simple form. We just updated that form today to include the date of your arrival, because we've had a little confusion over people who are pre-registering weeks before they get here, and we're trying to drop off things. We're jumping the gun, and they're blown away at our excitement, but they're not even in town yet. So we're working out. We just fixed that problem. But yeah, it is an amazing project to be on, and happy to do it as long as it's working. And it really is, as you said, we do have people who get their test back and are positive, and for sure, whoever in the state is doing that contact tracing has to be thrilled that that they've been in their room, or at least mostly. So
how many do you know of, Zach?
I can think of 4.
Really? 4?
Yeah, 4 people. Yeah. One we think might be a false positive because he swears he quarantined, and he quarantined before he got here. So there are some cases of that, but yeah, yep.
Excellent.
Yeah.
Well, and we're proud here in the mayor's office that Linda Murphy from the mayor's office is one of the part of the team that has been making these daily calls. And thank you to her. Thank you to everyone. Thank you to the volunteers that have been involved in this. I think it's I hope everyone on that team feels they were part of that graph that we opened today, where, we've seen a new spike and then it seems to be going back in the right direction. I think this team working on that has contributed to that. So thank you, everybody.
Thank you.
We got a couple more items. We wanted to. This sort of flows from the quarantine, and this is good news too, that we have testing opportunities like this that are open to the public. Some cases you can walk up, others you got to register ahead of time. Basically Wednesday, Thursday, Friday, we're testing already this week. Those are where to go. UVM Waterman Building, Sustainability Academy. And you can find out information about this on the city website and the Department of Health website. And this is just a great new capacity that we have that I think people should be thinking about how to integrate it into their organizations and their lives. In terms of how we manage this, manage our way through this. I don't think every week we're going to have this kind of capacity. This is still a response to the outbreaks that we've seen here, but it is really so far from where we were in March that the state of Vermont is able to deploy this type of capacity so quickly. The city will continue to do everything we can to help support them in it when we need it in weeks like the last few weeks. And I want to say thank you there to everyone involved in that effort too. All right, we haven't done one of these for a while, but the kind of cultural update of the day is about, as it often is, the Fletcher Free Library, the Summer Reading Challenge, the Imagine Your Story Summer Reading Challenge is underway. It kicked off on Monday, and you can sign up still at that website right there, fletcherfree.org. And there will also be signups at the nutrition sites in the coming days. And I can confirm that this year's t-shirt is awesome. I was wearing it on my morning coffee call to anyone who was part of that. I'm not sure we got to talk about that. But that was why I was wearing a t-shirt this morning. And there's lots of other great perks to signing up too. This is one of the great things that we do to try to make sure, I think it's probably more important this year than ever, right? The idea with the Summer Reading Challenge is to avoid, especially for our kids who might be coming from tougher situations, to avoid that backsliding that we know happens in education in between the end of one school year and the start of the next. This year's school year has been so disrupted that this signing up for the Summer Reading Challenge, I really think can make a big difference for a lot of kids in our community. Check it out. If you know kids who might be interested in it, check it out. It's a great program, has been for many years, and under the leadership of Mary Denko and Rebecca, this continues to be one of the great things the library does, and I encourage everyone to check it out. I think that is our presentation for the day, and got Erin Brown here in the studio. Erin, you got any questions for me?
I do. I have.
It's not the studio. Here in the mayor's office. Shifting into broadcast mode.
Yeah, it didn't even register to me that was.
Feels like a studio these days in the COVID
yeah.
era, but welcome to the mayor's office. What do you got, Erin?
So I do have 2 questions. The first one is a 2-parter. So
Okay.
I think it's 3 questions. So the first question, do you anticipate proposing more budget cuts to the police department in the future? And if so, how do you anticipate the role of police changing in Burlington with a smaller budget to work with?
So I do not expect to propose more cuts in the next week and a half before the budget for next year needs to be made. And I'm not sure that those cuts that are in this year's budget out of necessity, because we had faced such a hit to our revenues as a result of COVID. I'm not sure those should be permanent. I'm confident that we can get through the upcoming year without putting the public at risk with those cuts. That's what the chiefs have said. But what I welcome this reckoning that we're having about policing. I think there's a lot, and I say this, and this is always hard. And I want to say to the men and women of the Burlington Police Department that I respect them and I appreciate their sacrifice and their service. And I think that, I've said it before and I've taken some flack for it. But I think that people, I think there's a lot about our police department relative to other police departments to be proud of. I'm particularly proud of the innovations and the change that we've made over the last 5 years, as it's been a real focus since President Obama's 21st Century Policing Task Force came out with its report. At the same time, I believe now that there is a lot that is wrong in American policing in general, and that transformation needs to happen. And I welcome this national reckoning that we're having now. I think clearly not enough has happened since that 2015 reckoning. And we have more work to do here in Burlington. What I am hoping is that we can find consensus around a process for doing that additional work and deciding what is the right level of long-term police investment in this community. I am definitely open to the possibility, hey, it'd be great for our other priorities if we didn't have to spend all the money on policing in the future that we do today. That would be a very positive outcome. What I am advocating for with my colleagues and with the public is that we set up a process, and this is what I tried to say on Monday in the way we've submitted the budget, is that we commit to immediately, this is not going to be some long drawn out dilatory process. I don't want that. I don't believe in that. I like action. But I think it's not possible. It is not possible to make the decisions and know you're getting them right on the time that we have left before this budget must be passed. So I'm hoping my colleagues on the council will agree with that, and they will support in some way some kind of process. And I am very open-minded about what that is. I think professionals should be involved. I do believe in expertise and bringing the learning of other communities who are ahead of us into play. I think, I wanted to do that last summer. I appropriated $50,000 for to bring experts in to help us with these challenging discussions, and we ended up not using that. I think here's another opportunity, I think, where we should put some resources and we should put community focus into quickly figuring out what can we change going forward. What other professionals can we get involved that reduce the need for Burlington police officers to have to respond? What things should we just stop doing? Just because we've always done it does not mean that this is the right thing to have our police officers do into the future. And I hear that loud and clear, and I'm troubled by the number of people of color we've heard in the hours of public forum over the last 2 weeks that have said they do not feel safe with Burlington police officers. They do not feel well treated. We've got to get at that, and we've got to get to the heart of that and find a way to change the culture of the institution, and to develop better understanding between the people of Burlington and the police department, so that that's not how people are feeling a year from now or even 6 months from now. We need to do this urgently and quickly. And at the same time, I think we got to do it right. And if we don't do it right, ultimately we will not serve anybody's interests. If we don't do it right, it won't work. We'll get it wrong. History is full of precipitous decisions that backfired and didn't get done what they were intended to do. I'm advocating for urgent action, but getting it right. And I think we need a little more time and some focus to do that.
Thank you for your response. So so right now you don't anticipate making further cuts beyond the 1.9 million.
My budget is in the hands of the city council now. That's the way our system worked. I had to deliver a budget on Monday. Frankly, I wish I had more time. It was very challenging this year to get it in by the deadline. We got it in on the day it was due by the charter. It was the hardest budget process by far we've ever been through. I've been doing this is my 9th process, and never imagined I thought I thought we knew how to do it by now. This was completely different. We had to cut, basically, we had to find a way to deal with a 15% hole in the budget. We've never had a hole anywhere near that size in my 9 years. But no one in city government has seen anything like this, I think, in 100 years. So we had a huge challenge to begin with, and then 3 weeks before the budget was due, this seismic event in American history took place, and George Floyd was murdered, and it created the need and opportunity to do things different going forward. And I want to be clear. I'm not saying it was a tragedy, terrible tragedy. What has happened? The response to that, the outpouring of millions of people from around the country and even around the world, has created saying that this cannot continue. The status quo cannot continue. It's telling that to me and our city councilors for hour after hour. That has created an opportunity, a window for change, a moment where we can make racial progress. I believe long overdue racial progress on in policing, but not just in policing. I think there's a need and an opportunity to do it in public health. I think we could do much more in housing and other areas of city government. And we tried to rise to that moment with the budget, and we got it in, and we got it done. But what happens from here? So it is now in my hands now. It's not really the mayor making changes from this point. I'd like to be part of the conversation with the council if they want to make further changes, but it is now things shift from the mayor's responsibility to the council's. They ultimately have to approve a budget. There needs to be 7 of the 12 of them need to approve it. They are required to do that by June 30th by the charter. And I'm going to be support them and give assistance to them in any way I can. I'm sure I'll advocate for certain things as I am now, but it is really their call from here as to what the final budget says.
And my last question, I know a lot of people at the public forum, they were echoing the demands of the Racial Justice Alliance, specifically the demand to reduce the police force by 30%. What are your thoughts on that? Do you think that's a realistic request, or?
I mean, it may be. Maybe we can do that. Maybe we can see over time a reduction of that level. Once we've had the conversations I was just talking about, once we've decided, we can't do it today when we expect the police to respond in so many ways to so many different things. The reason we have the number of cops we do today is because the community has asked through the generations for certain things to be done and for certain responses to happen. And so I don't think we can make a decision, know confidently that we can cut 30% on June 30th and be confident in that decision. I think if we have some time with this and can figure out what do we want the police not to do anymore, what do we want them to do differently, then if we do that hard work of transforming what this agency is responsible for, then maybe. And I think and I appreciate the Racial Justice Alliance putting that as a target on the, for us to shoot for and pushing it into the conversation. And I respect it as a goal. I do think, I hope my colleagues on the council agree that we need some time to get this right. I would say even if we look around the country at where transformation is taking place, Minneapolis being the biggest example, they are talking, a majority of counselors there say they are going to dismantle the police department. And that's a big statement. A lot of people have heard that. It's important to hear what their follow-up statement was as well, is it's going to take some time to do that. They are expecting more than a year of process to actually create a new agency to replace it. And so I think we have to have a little bit of that perspective and patience here too. And I know I know after 400 years of injustice, I'm talking about patience and waiting is hard is not the right message. And I know too often in the past, patience has been urged as a strategy to get nothing done. And that is not what I want to do. I want to make the most of this moment. I want to get this right. I think it's going to take more time than we have when this budget needs to be approved. But I hope what this budget does do, I hope what it will include when the council is done with it, is the funds, the resources, this transformation fund to do the work and then make changes in the year ahead.
Those are all my questions. Thank you.
Great, thank you. Olivia, do we have more from the Zoom?
We do. Next up is Aiden Quigley from VT Digger. Aiden, you should be able to enable your microphone.
Thanks. I have kind of a follow-up question on the budget. Do you have veto power over the budget? How does that work?
So Aiden, here's how I understand it works, which it will be, it's never worked this way in the last 8 years, but it could well this year. It's interesting. It's sort of like a line item authority. Here's how it works as I understand it. And so I say this never having actually seen it play out, but I believe if the council wants to change, it wants to reduce any budget lines, cut something, they can do that on a per line basis with a majority vote. If they want to increase any budget line, that takes a supermajority of 8 of the 12 councilors to increase any budget line, including a decision to increase taxation. That's my understanding of it. Again, since I've never actually, there's not in my 8 years, there's never been a vote, even a proposed amendment, I don't believe, on the floor in the last 8 years. And all but one of those budgets passed unanimously, and one of them, I think last year, one councilor voted no on the budget. So there's never, we worked really hard to try to build consensus. By the time that we address disagreements in the weeks leading up to the submission, and that's worked in past years. We're in a very different year this year, and I listen. I'm completely supportive of the council given the circumstances here, taking the extra 2 weeks, not voting on Monday as they have in past years, taking more time with this. And these are, I welcome their thorough review, and the city will be, the administration will be as supportive and responsive as we can over the next week and a half to get them what they need to finalize these decisions.
Thanks. I have a couple more questions. I'll try to be quick, but can you expand on your shift on thinking on the school resource officers? Is there anything specific that you've heard that has kind of led to your reconsideration of that program? I'll say it again, Aiden. I don't think I have much to expand on other than my confidence in the school district's position is shaken by the questions about this communication to me in this letter. And that's got to be addressed by the district. What happened there, I don't really understand. We got an email in my office that was from Superintendent Obang's email address, and from him, and then a letter that he had signed, and now, and that mattered to me. I have respect for Superintendent Obang, and that he so quickly and confidently wanted to support that letter. We have no responsibility in the city government for the schools, but we try to be good partners to the schools. When they ask for things, our default is to try to say yes. And so they have been, I'd understood this program to be one that the leadership squarely supported, that seemed to be reinforced by this communication. Now that communication, there's some doubt around it, and that's shaken my confidence in it, and made, and then on top of that, I think the people have been reaching out to me, make a very strong point that, in a time when we are reevaluating policing, when we are asking this question, should we keep using the police to do the things we have in the past, or should we do things differently? even if the district had already had this position before George Floyd and before the reckoning in the last couple of weeks, it's a good time for them to reevaluate it. And that reevaluation has to happen, not just as a bunch of administrators talking to each other, but with the involvement of students, of parents, of teachers, particularly students of color. And so, you know, I really, you know, again, I've talked to Tom Flanagan, the new superintendent, and there's time for process to happen before the school district reopens this fall. And I think it needs to before we expend these funds.
Thanks. And last question. Sorry, there's a plane flag overhead, but should citizens be concerned about the rise of non-fatal overdoses in the city? And what resources, if any, has the Recovery Center been offering to those struggling with addiction during the pandemic?
Thanks, Aiden. I think I'm seeing what you're seeing on the city's dashboard there. That overdoses appear to be non-fatal overdoses appear to be up substantially during the kind of coronavirus era period here, that fatal overdoses are not up, is my understanding, but the non-fatals, the way we're collecting the data, at least appear to be, and I'm concerned about that. It's been that way most, pretty much throughout the quarantine, the stay-home period. I'm concerned about it. I don't fully understand what's going on yet. We are having our first community stat meeting since the pandemic began next Thursday, I believe, and that is one of the top questions, is to try to get our sense from all of our partners, what is going on here, why is this happening, what can we do differently. We have been doing some things differently, or at least I believe we are during the pandemic. The federal government, one of the quick actions of the federal government was to change buprenorphine prescribing rules and make it easier for prescribing to happen remotely through telemedicine and some other rule changes. I want to hear how those changes are working, how they're actually being implemented. I'm hoping we hear from people who are taking buprenorphine at this next community stat, how the new system is working for them. So good question. It's the question on my mind too, and I'll have a better, more of an answer for you after our next community stat meeting.
Thanks.
And it looks like those are the questions we have for members of the media today.
Great. Thank you everyone for tuning in. Our plan at this point is to be back again on Friday at 2:00. And we really appreciate everyone participating in this. Thank you. We'll see you soon. Stay safe.